Hello, my name's Raven,
My name's Elena.
and we did our project on the Philippines. So the three main causes of premature death in 1990 were lower respiratory infections, preterm birth defects, and TB. So the largest number of years of life lost in 1990 was 30,690 deaths, causing 21.4% of the deaths in total. And in 2010, there was 2,000 deaths, resulting in 11.1% of the overall deaths. So from 1990 to 2010, the leading cause of death remained lower respiratory infections. However, it decreased by 47% of total deaths. Ischemic heart disease rose from fourth to seventh place and increased by 92% of total. And stroke rose from second to third place, increasing of 102% of deaths. Measles dropped from 8th to 23rd place with a 57% decrease. And less communicable diseases were among the top reasons in 2010 when compared to 1990. And more non-communicable diseases were responsible for more deaths in 2010 than 1990. So it's going to be the percent change when the graph appears.
Do you want me to move on?
Okay, so for the years of life lost from 1990 to 2010, lower respiratory infections had a negative 47% change. So it decreased, possibly due to the increased education on prevention, better living conditions, and increased medical or medication supplies. For preterm birth complications, there was a negative 1% change from 1990 to 2010, possibly because there could have been an increase in education due to predicted or suspected decreased fetal outcomes, decreasing the percentage of mortality. But there also could have been an increased maternal education on lifestyle, diet, and prenatal care. But this also could have maybe fluctuated with the amount of births. And it didn't change much, possibly due to the decreased access to healthcare, suspiciousness of the healthcare system, and inability to afford prenatal and healthcare services. For tuberculosis, there was a negative 11% change from 1990 to 2010. It's not a drastic change, but it's possibly due to better living conditions and education on prevention and medication availability. It probably didn't change too much because of the improvement of living wasn't drastic enough. The poverty rate based on location and income, and decreased access to healthcare, inability to afford healthcare services or normal checkups or medications.
Okay, the top 5 leading causes of years with disabilities, living with disabilities, is number 1 being low back pain, with the highest incident rate being the ages 15 to 59 years old, and the lowest being 0 to 4. And then following that, major depressive disorder, with the highest incident rate being from ages 25 to 29. And the lowest being 0 to 364 days. And then after major depressive disorder is iron deficiency, which has the highest rate in individuals from 1 to 4 years old, and the lowest from 0 to 27 days and 80 plus years. And then chronic obstructive pulmonary disease, with the highest incident rate being of 10 to 14 years old, and the lowest being 0 to 4 years old, and then 80 plus. And then in 5th is tuberculosis, with the highest being 40 to 49 years old, and the lowest being 0 to 9 years old and 80 plus years. Some reasons for the differences between the incident rates increasing in age is because that as their age increases, the hardships they must endure increases. So they start to do more physical labor, and the stressors of day-to-day life start to affect them more. And as the responsibilities become more expected, the less they care about maintaining a healthy life and more about living. And then for the iron deficiency and chronic obstructive pulmonary disease, it's due to the age and the high susceptibility they have to these diseases. So the top 3 disability adjusted life years is lower respiratory infections, ischemic heart disease, and tuberculosis. Lower respiratory infections is a communicable disease and has decreased the greatest percentage between 1990 and 2010 out of all 3 of these. And then ischemic heart disease is non-communicable, tuberculosis is communicable. And the reason why diabetes is on this slide is because it has the highest growing incident rate between the years 1990 and 2010 and needs to be something that should be looked out for because it is causing some health problems. And then finally, some risk factors that affect premature death is dietary risk, following by smoking, and then finally high blood pressure. And this concludes our presentation, and here are our references. Thank you.